Good evening, everybody. I hope everybody is doing well. We are here for another interesting session, and I'm going to be joined by Dr. Mukherjee. Let's see if I can find Dr. Mukherjee. Let me see if I can just add her. I hope everybody is doing good this evening. Yes, I see Dr. Mukherjee. I have sent her an invite, and she should be joining us. And she should join us any moment now. Great. We
Hi,
have Dr.
Sati.
Mukherjee. Good evening, Dr. Mukherjee. So, everybody out there, this is Dr. Mukherjee and Hustling Muscles signing in. So, we are here again for yet another amazing session. And before we start, I have to congratulate Dr. Mukherjee. So, finally, all her prayers were answered, all her wishes were answered, and Max won the championship, and he's the champion of the world.
Yes.
So, Sir Lewis Hamilton now played it
Yeah.
beautifully. He had the control throughout the race, but I think the last 30 seconds, the entire story changed, and they say
Absolutely.
it was Max's victory, and as they say in Hindi, "Jo jeeta wahi Sikandar." Yeah, there were a lot of debates here and there, but as Dominic Toretto said, another precision driver, he said that you win by an inch or you win by a mile. Winning is winning. So I think that's
Absolutely.
perfect out here. So I think congratulations. I can see the smile and say yes.
Yeah,
That was
I was
great.
on the verge of crying, and then the last lap just changed it also. It was actually pretty great.
It was one of the most amazing races. I think it'll go down in history as one of the most amazing races. So yeah, it was great fun.
True.
So we're now on with Ashes. So I think sports never stops. Sports somehow keeps going on, and I think the Ashes are also going to be an entertaining one. Uh,
Correct.
okay, so moving on from sports and coming to today's topic. So today's topic is again something that you are pretty much, it's a part of your field. I know you have this on a day-to-day basis. You have been talking about this. You've explained this in a very much of a better manner, though I know about this topic. I have been in the industry, so I've seen this topic, but I know you advocate for this topic and you are trying to take it to another level. People, we are talking about fitness tests. Now, fitness tests, we know, in sports, it's always been the athletes have different level of, tests. Even we people today have particular tests. So there are various tests in gyms today. You have something called the musculoskeletal test. So before we come to that, you have other tests like the beep test or the agility test or the Harvard step test, or the test that is most famous is the yo-yo test. Yes, we people I think very much are familiar because we are all lovers of cricket, that we know what the yo-yo test is, something what the Indian cricket team has to go through. I think it was brought in by Kumble, if I'm not mistaken, during his tenure. It had come in and it has somehow stuck, and players have to go in through these yo-yo tests to prove their fitness abilities and move forward. Dr. Mukherjee, why don't you explain to the people out there the key reasons why these fitness tests happen? Especially a yo-yo test or the other test. Why does it happen for, these fitness people and these athletes? Could you give the viewers out there a little understanding about these fitness tests?
Okay. So basically, fitness has many components. People think it's only power, only strength. No, it is like a combination of everything. So we'll be checking strength, we check power, we check endurance, we check cardiorespiratory endurance separately to check the heart and lungs separately, along with that balance, agility. All of these components come under fitness testing. So you have a lot of tests like the step up tests or the Bruce protocol, which is actually a gold standard in checking cardiorespiratory conditions, which you might have seen in movies also, that people are walking on treadmill and their heart rate and all is being monitored. So yes, yes, Kal Ho Na Ho Raha, we were talking about it the other day. So that is actually the Bruce test, which is done. So at stages, the inclination of the treadmill as well as the speed at which the person is supposed to be walking, that keeps on increasing until the person reach their maximum limit. So this checks their heart, it checks their lung, it checks their maximal oxygen uptakes, as well as it tells us whether they are susceptible to any cardiac condition, which is the most important thing. I mean, before going into fitness, first you need to understand your baseline, see where you stand, see whether it might be causing you any kind of injury or might flare up any cardiac condition which is already present, and then only move forward. So we have other fitness tests also, like you told, that there is a vertical jump test, there is a beep test, or people keep saying that beep test and yo-yo test is the same. Yo-yo test is actually very different from the beep test. It is more complex. It has 6 stages. First is just the testing, like running between the cones. Okay, so we are just checking their endurance. Second is checking their endurance, but intermittently. So we give them a little break between checking their endurance, about a 5 second break between every 20-meter shuttle. And the third, that is the last 2 stages, are intermittent recovery. So the recovery is much higher. The time duration that they can take a break is much higher. That's about 10 seconds, but still they need to be running. So the yo-yo intermittent test, like 22 is a great score, and the Indian cricket team had it at 16.1 for a very long time, and then people started to push it. So for a team like New Zealand, it's 19, and so Indian team tried to increase their minimum requirement, and for even Pakistan's cricket team, it's like 17.4. So all of this are different scoring. Basically, yo-yo testing helps us understand what is your endurance. Along with that, what will be the speed and the agility? That means how quickly can you turn your position when you're running between cones, because you have to shuttle, then you have to shuttle back, again you have to shuttle, you have to shuttle back, and the time keeps getting less and the distance is same. So all of these tests, they are telling us various things about our body. Okay. Now, fitness testing is very important. Why? Why do we need to do fitness tests? Is because we need to know where we stand. Okay. Without checking, I mean, like what happens is we are going ahead with our regular, going to the gym, doing exercises, aerobic exercises, running, everything. So it's like we're depositing money in a bank. But how do we know how much of money we have deposited? Okay, we need to keep checking the balance, right? Otherwise, we have no idea. We have a vague idea. Okay, my strength is pretty good. My balance is pretty good. But pretty good is what? You need a numerical value, right? So that is where fitness testing comes in. Not just for athletes, not just for performance artists, but also for the regular population, because that is how you know where you stand fitness wise and how much more you need to go. So where you stand, whether you're ready to go into fitness or not, and after some time when you do the fitness testing again, you get to see where you have reached. So it also helps in setting goals. Okay, so fitness testing is really, really important, and it is mandatory that it should be done by a trainer who is certified either in doing fitness testing, like a proper certification, or a physiotherapist or a sports medicine doctor.
Well, I think you've put in a brilliant way where you've connected, with the fitness and banks and, fitness and the finance sector. Health is wealth, they say. So I think all the bankers are going to give you full marks on that at least. So we can be assured of that. Now, talking about musculoskeletal evaluation. Now, musculoskeletal evaluation is something that you do very regularly for your clients. Now, musculoskeletal evaluation, if I am not wrong, came into the industry somewhere in the mid 2000s, where fitness centers started, using this approach. When a person would come in, we would do a musculoskeletal evaluation. Then every 45 days to 90 days, they would have a review of this to see how it improves, things like that. And somehow musculoskeletal evaluation is now in most of the fitness centers, most of the gyms. They may have tweaked it, changed it. What are the components of this test and why is it so important? Because I think musculoskeletal test is one test where normal people like me and others go for it. It is there to judge, our fitness levels. Could you explain a little about musculoskeletal evaluation and, its components?
Okay, so musculoskeletal conditions are responsible for the maximum morbidity and disability in our generation. Okay, so this has different presentations and they have different diagnoses. And a musculoskeletal test or a musculoskeletal assessment, it helps in assessing the musculoskeletal system. What is the musculoskeletal system? Okay, your muscles, your bones, tendons, ligaments, joints, everything that makes up your body. Now, whatever activity you do in your daily life, whether it be getting up, brushing, going to the washroom, making your food, making your tea, coffee, just going out to the garden, sitting, enjoying your cup of coffee, going to work, all of that is done by your musculoskeletal system. Okay. Now, to be able to prevent any injury, to be able to set up goals for your fitness, as much as to be able to avoid any other medical condition from cropping up, or preventing any medical condition from cropping up, or even identifying a medical condition that is already present in the body. Musculoskeletal assessments are necessary. Okay, so one of the most important things that the musculoskeletal assessment does is it tells us about our baseline values. Okay, how is our posture? How is our strength? How is our flexibility? How is our endurance? You don't have to be very fit to be able to go ahead with a musculoskeletal assessment. So usually in like any kind of fitness training, we have the musculoskeletal assessment first, then we have a little bit of fitness training given to the person, and then we go ahead with the fitness test. Because everybody cannot do a fitness test very easily, but musculoskeletal assessment needs to be done for each and every person. Why? Because it's one of the major ways of examining your body. Okay, so there are different components. First is just an observation or just an inspection of the body. So just by observing a person from the front, side, back, you can check out multiple things, like whether they have a swelling, whether they have like a poked chin or a slouch posture, or they have a curvature on their spine, also called as scoliosis, or a hunch spine, like a kyphosis, or they have knock knees, flat foot, whether the flat foot is flexible or not flexible. These things you can easily see just in the posture. Now, there was a client yesterday who had come to me who was actually telling me that I have a flat foot for a very long time. It cannot be fixed. So I actually just checked his posture, like how was he sitting and standing. And sitting, there was a curvature. Standing, there was a reduced curvature. So I said that you have a flexible flat foot. And anybody who has done an assessment on you will be able to tell you this, rather than telling you that, oh, you have a flat foot from childhood. So it is that important, just by doing a observation, that we can understand where the problem is coming from. Secondly, palpation. That is, with a light or firm pressure of the hand, we check. We check for the warmth of the skin. We check for swelling. We check for how is the muscle movement, whether it is comfortable, whether it's painful. We can also check for trigger points this way. Okay. Then we check a lot of things with the palpation. That is the joint range of motion. How much can the joint move? The flexibility of the muscle, the strength of the muscle, the reflexes, to check the neuromuscular system, whether it is working intact or not. Okay. So these things, they help us know the baseline of the person. Secondly, if there is a deviation from normal, because whenever we are checking anything, there are values which have come from research where we know how much that the person deviate from the normal values according to their age. Okay. If there is a deviation from normal values, we will know that the person might be up for an injury, or the person might be having an injury that has been unexplainable for so long because of this particular reason. Like a runner who's not able to increase his running time. No matter what he does, he's doing all of the right strength training, but he feels tired after a certain period of time. And doing a proper observation examination, we might be able to see that the person is not breathing correctly. The person might be a chest breather. So his lung is not opening up. His lung volume will be low. These are all things we can check in the assessment, which we would be completely missing out, and we will just be worried, okay, how to increase this person's running capacity. So first kind, observation, then inspection. Then we came to the joint range of motion, flexibility of the muscles, strength, reflexes, then comes balance, and agility also is sometimes checked, okay, in a very minimal manner in the musculoskeletal assessment. Now, this is very important to be done when the client walks in. So you take a complete history of their condition, what work they do, what they do in their regular lives, any previous surgeries, any previous injuries, all of that. And then you do an assessment. And that is when your patient examination is complete. Now, this assessment is not possible by anybody else, because only physios or sports medicine doctors are trained in taking this assessment. Anybody else, the test will not be that reliable or valid. So MSA is an important thing. It should not be done by just anybody going to the gym. It should be done by a proper professional who is trained in it.
So I think everybody must have got an idea, because I think everybody must have gone through this fitness test if they've gone to a gym and things like that. Maybe they could have got a better idea right now of how and actually why this fitness test happened. Maybe it's an eye-opener. It's been an eye-opener for me, and I'm sure it's an eye-opener for a lot of people. But Dr. Mukherjee, tell me one thing. How different or how, challenging is this when compared to a yo-yo test, the difficulty levels and things like that. What impact does it have on the performance output? And is this something that we can self assess, look on the internet? Because the internet is filled with all this. They tell you you can run a yo-yo test like this. I'm doing this, you can also do that. Can a person do this on his own? Is it advisable or no? Could you also tell that to the audience out there?
Okay. So for everything that we check, okay, like it can be an endurance test, it can be a speed test, it can be an agility test. So we have to check the test which has the highest reliability and validity. Reliability means can it give the same results consistently when done on different people, and validity means is every time the test done, is it done accurately? Okay, so these two things make a test a gold standard to check that particular thing, whatever thing it is measuring. For example, a Bruce test is a gold standard for checking the cardiorespiratory endurance. Okay. Now, what makes this a gold standard? Okay. When we check via research the reliability and validity of these tests, which was administered by people who were trained to do it. That means that there were about 20 physios or 30 physios or 100 physios or 100 doctors who did this test and got the similar results because they were trained in doing the test. What to do before the test, how to perform the test, what to do at the end of the test, and what happens or what do you do when the test goes wrong. Because when we are checking a person's cardiac condition for the first time or making him run, somebody who's sedentary, making him run, so we need to be prepared for what happens if things go wrong in the test. All of these four things a doctor or a physiotherapist is trained in handling. Okay, which is why in research only they are used. Now, a regular person might have gone through the test via YouTube, via going through all of the things, but how many times has that person administered the test? That is very important because the same reliability and validity which was done in research on PTs is not going to be applicable for a regular person. So that test has a low validity and reliability now. That means the test is not reliable. Why do a test which is not even reliable and not even going to give you the right results? This is why only physiotherapists and doctors and certified trainers who have gotten a certification in being able to perform this test and get the results should be doing this test. And not just anybody on the internet should be doing this test, because understand, honor the test, honor that this test has become gold standard because of specific criteria that it has fulfilled. And if you're a regular person and not a doctor, you don't fill up those criteria. So by chance, if something goes wrong with the client while doing a cardiac test or a yo-yo test, you have absolutely zero idea of how to be able to manage it, even provide first aid. Most of the trainers don't even know how to provide first aid correctly. So it is very important that this should be done under supervision of somebody who is trained to do this test, not just because they will be able to perform the test more easily or they'll be able to tell the person how to perform it more easily, but because they can manage it and it has been practiced only on them.
Well, what I've liked the most, I think, and I think people have to make a note of, is the reliability part. If the test is not reliable, there is actually no use, trying to do it. And one more thing, guys, you have to undertake and rather underline, when things go wrong, what do you do? That is very, very important. I hope everybody is listening to this part. When things go wrong, what to do, that only a doctor or a physiotherapist can handle. That is a very, very true fact. So I think this is something people have to take back, make a note of. And as I say, I underline this very strongly, what to do when things go wrong. That's something very, very good and great you have, I think, shared with the people out there. Now, my next question is pretty simple. These fitness tests and stuff like that we do, how much of an impact does this have on our lifestyle? Does it improve our lifestyle?
Of course, it improves our lifestyle because, like the same way that exercise improves our lifestyle or fitness improves our lifestyle. Now, how do you know what you need to do in fitness? Okay, you need to know your baseline levels. Okay, for example, I am somebody who has not gone into fitness before, and I want to improve my strength because I want to be able to do my daily activities. Like, I have a child that I want to, lift up and hold and walk around during the day, be able to cook in the kitchen for long, or sit and do my work for 8 to 9 hours a day. So I have to increase my strength. Now, how do I know how much strength do I have and how much do I need to go? Like, you don't even know if you have to go from A point to B point, then how are you going to get there? So that is where fitness testing comes in. It tells us that we are at A. It helps us decide our goal. Yes, this is B. This is the point I need to reach in 3 months' time, 6 months' time, 1 year time, and then do the test again, because my strength is slightly better, completely better, little better. These are all very vague answers, and there is no vague terminology used in the medical field. Okay, there is only numerical values, like how much was your strength before in this test, how much did you score, and how much is your strength after a couple of years of strength training or after a couple of months of strength training. So, fitness test helps us understand where we are and where we need to go. Secondly, we all want to be healthy when we go into fitness. We don't want to get injured, right? We don't want to flare up a heart condition that we might not have found out previously. So fitness test helps us understand whether we are ready for the fitness that we are looking forward with. If I'm somebody sedentary and I want to suddenly go ahead with marathon training, and I have not checked any of, like, I've not checked my heart previously, I've not checked my BP, I've not checked my heart rate, I have not gone forward with checking my entire body, I've not done a musculoskeletal assessment, definitely it will lead to injuries later, because there could be chances of having injury. I have not checked them out. So getting to know whether your body is ready for fitness and which kind you require, even for that, fitness training is very, a fitness assessment is very important. Because if you are doing a Bruce test and you are not able to sustain a certain angle at which the treadmill is working, or a certain speed, and your heart starts to fail at that time, then that is the first sign that there is something wrong with your coronary arteries. So immediately we'll be sending you to get an ECG done, to get a Doppler done. We will manage it for that time. And then we might be able to find certain underlying medical conditions that might have been completely overlooked, and you would have actually gone into fitness. So this is a very important part. Whether you're ready, where are you, and where do you need to go? If you want your fitness to be fruitful, it is important to test it, check it, measure it. Otherwise, whatever you're doing is just like you're putting things into the well and you don't know how it is going to come out. Okay, you're just like doing a guesswork. And I don't think that we should be doing guesswork anymore, especially when there is so much evidence out there. Our fitness should be very evidence based.
Guesswork doesn't work, and as you said, it should be evidence based. So again, those are points we should be underlining and taking from you. Well said, doc. Now I would ask you my next question, which is basically again on the fitness test. Is there an age criteria? Because now I'm seeing people who are towards their 45, 50s, 60s are very much present in the fitness centers. They like to stay fit, they are trying to work out things like that. Is there any age criteria that, okay, this age limit can do the test, this age limit can't do the test? What is the correct thing? Could you please advise us?
Okay. So we would know that there is a lot of difference between probably somebody who is 50 years old but has been an athlete all of his life and trains every day. That person might be fit to take a fitness test. And somebody who is like 20, 22, 23 has never been into exercises, has always been sedentary. So in this case, where do you draw the line? So it's not really so much about the age. It's about how much has that person been into fitness. Which is why I again say this, that you should first be meeting a doctor or a physiotherapist to be able to understand whether you are ready to start off with fitness. They take your history, they rule out any medical condition, they do a musculoskeletal assessment, which can actually help us understand whether there was any underlying condition or not. Okay. After we find all of these things out, we can go ahead with the fitness test. Yes, your doctor can clear you for your fitness test. Okay. There are certain senior fitness tests also. These are certain special tests which check the body composition, upper body strength, lower body strength. They can be done on people as old as 70 to 80 as well. So there is age appropriate fitness test for everybody. Okay. So only somebody who is a trained professional will know first, what is the age appropriate fitness test for you? Second, in what condition should that fitness test be given to you? If these two things are not known, it is unsafe to take any fitness test. Because understand, you're pushing your body 3 to 4 times of your maximum ability in a fitness test. You're either running too hard, or you're jumping too high, or you're going forward with continuous activity which your body, your heart, your lungs might not be used to. So that is why it's very important to first get yourself screened or assessed, preliminary assessment to be done by a physio or a sports medicine doctor, and then to move on to fitness testing. Age here isn't really a limitation, because I have seen very unfit people in their early 20s and pretty fit people in their 50s or 60s. But definitely chances of getting medical conditions like a cardiac condition or anything very similar to that can happen with advancing age. So again, a doctor will be able to check you out, a physiotherapist will be able to check you out, understand whether you are fit to take a test like this. But there are multiple tests to be taken till 80 years. So
So, yeah, you I think have answered. I think Gauri has asked us, is it necessary for older adults to take a fitness test? Gauri, you need to mention your age, so we'll need to know how old you are, 60, 65. So Dr. Mukherjee has answered that for us. Now, sticking on to the age part, I want to know one more thing. Now, they say as per studies, we've had this conversation earlier also in our talks. you know People as they grow old, if they're going to work out, if they try keeping workout, they tend to be more strong and tend to be more independent. I remember once even you saying that when people grow old, at times they suddenly fall and things like that. That is due to the lack of flexibility, a lack of workout that they've been doing. So a lot of people now try to stay active, especially over that 50 plus age. Now, is this point true, where researchers says that these tests help older people to have a knowledge of how strong they are or how strong they can become? So is it true or false? How would you say that?
no, absolutely. These tests are required, especially for older people, because they are at a higher risk of developing a medical condition, or probably they already have a medical condition which has not been screened, which has not been assessed so far. Secondly, they require to be fit because they have to be functionally independent. They should be able to carry off all of their work independently, like being able to go to the washroom, brush their own teeth, move around in the house, go and buy vegetables outside. And I'm talking about people who are probably retired, or they might want to travel, they might want to see the world. So old people are especially, like they should not be neglecting their fitness testing at all, because the fitness test should be performed by the physiotherapists and doctors on them to understand where do they stand. Again, whenever we are talking about numbers, okay, we are talking about statistics. Are they in the bell curve? Are they on the extremes? Are they extremely fit? Are they extremely unfit? The only way of knowing that is via going through fitness test. For example, if I am deficient in vitamin D3, or if I go to a doctor and I tell that, okay, like I have not been feeling well, I might have tingling in my fingers and I feel very tired. So a doctor is going to obviously take tests, right? And they're not even going to take any time. Like you walk into any doctor's clinic right now, they'll immediately send you for a lot of testing. So why is a doctor testing all of these things? Because they want to know where we stand, so they can go ahead, plan the further treatment. The same applies for fitness testing. If I go to a doctor and I am not very fit and I need to start off with exercise, or it's not just about that I want to be fit, like I'm not able to do my basic activity and I need to start off somewhere. How do I start? I need to do a test to be able to understand where I stand and understand my goals and then move ahead. Okay, this also acts as a motivation factor for the person. The same reason, this is going to be a very unpopular opinion, but the same reason we keep stepping on the scale every time, because we want that motivation that, I am losing weight. Yes, I'm going somewhere. I agree that that is not the only thing. We sometimes feel stronger. So we need to keep feeling motivated. How do you tell somebody that they're unfit without doing a fitness test? You can't just look at somebody and tell, no, 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 you are unfit, you are fit, because that is absolutely a vague thing. You can only do that with a fitness test. So keeps them motivated, helps them understand where they stand, helps them achieve their goals of being independent. Absolutely required for elderlies.
So, one point which I really like what Dr. Mukherjee said, when she said certain retired people, when they like to travel and things like that, a lot of people were like, who will travel, at the age of 60 and, or, for it, I don't know, I think you may know this, you may not, but Wahida Rahman, Asha Parekh, and Helen, the three trio, I think they must be 80 years, they're super senior types. And I think they still travel to a lot of places at this age, all three of them. I remember seeing this in all.
Wow.
So, this is the beauty, this is the beauty of staying fit, staying independent at a particular age where, you can explore, and, this is where it comes. Age is just a number. So I think there's no better way of putting this. So I don't know. I just saw this, this thought came into my mind. So I thought, let me share this with the people out there. Maybe it can be motivation, when you retire, okay, we also got to travel. Okay. Now, coming back to the topic. Okay. Now, you've already touched on this, but I'm still going to ask you this question. Who and all are, you know, capable or, can evaluate these fitness tests? Okay. Why I ask this is because it should be, because right now there are physios, non-physios, both doing these tests, because you know how the gym business has increased, how trainers are. You have trainers with experience, newcomers, everything. And as I said, this test has had its own tweaks at times. Maybe it's not done in the same way in many fitness centers, because I have visited many fitness centers. I have somebody who's worked out in XYZ number of fitness centers. I love doing that. And I observe these things since I come from the administrative side. I love to note these things of a gym and all. So I want this explanation, is it only for a physio or a non-physio, or who else can evaluate these fitness tests?
Okay. So basically, anybody who is evaluating this needs to be properly trained in it. Usually, sports medicine doctors are trained in it, physiotherapists are trained in it, and certain certified trainers, not every fitness trainer. I mean, certified trainers, when I'm talking about that, I'm talking about people who have got their, accreditation from some prestigious place, like an ACE trainer should be able to go ahead with this, because they have studied about it, they have understood it, they have practiced it, and then they have passed their exam. The reason we have an exam for these things, anybody who has not studied hard enough, not passed an exam, and there's not being approved by other people, is definitely not going to be able to go ahead with this test. Again, now coming research wise, okay, this test has only been done by doctors, physiotherapists, and certified trainers in research. So the layman has not been, included in the research at all. So the reliability and validity was only checked on physios and doctors and certified trainers. Anybody else who is doing it might not be doing it accurately, no matter how much they've studied. See, we can keep on studying, but we'll never learn how to do surgery, right? Just by watching YouTube videos. We will never even try because we feel that that is more life threatening. I don't understand why people feel that doing a fitness test is less life threatening. So maybe I can give it a hand and like go ahead with it. So I would like to tell you that just because you have gone through the test in on your Google, on your YouTube, does not make you a certified person to take this test and practice it on other people. Understand that there are certain criteria that you should be fulfilling. And if you are a patient or a client who is watching this, who is thinking that no, this test can be done by anybody, please don't, take your health so lightly that, it's okay for you that if you get injured or if you get a little bumps here and there, and if you get a medical condition, don't take your health like that. Okay. So we have to understand that health is wealth, and go to a proper certified trainer or a physiotherapist or a doctor for these tests, because anybody else doing it is not doing it accurately.
And I would like to repeat, I think, what Dr. Mukherjee had said earlier. You have to know what to do when things go wrong. So I think that should be again taken into consideration, which is very, very important. That's at least a learning for me for today. Okay, I don't know people out there, but for me, that's a learning I take back today from the conversation. Now, moving on. Okay, now I want to know if people have medical conditions. I am saying like if a person has diabetes or heart problems, things like that. Do they need to declare this before they take the fitness test, or these diseases or these conditions don't matter with the fitness test? How is it? Could you explain it to the viewers out there?
Oh, absolutely. They need to declare it to their doctor. I mean, there is an old saying that goes that you should never lie to your doctor or your lawyer because they're eventually going to find out what you have or what you did in that case. So you should never be lying about your medical conditions, even if you have it, because some people, they do tell that, no, no, I don't have anything because they want to start off with their fitness training or they want to go ahead with participating in a marathon. Guys, please be completely honest with your doctor. Tell them your previous medical history, any family history that you have had, any injury or surgery you have had. Along with that, any random symptom, like there are certain times you feel a flutter in your heart or you have difficulty breathing when you're climbing up steps. These are the small things which can literally save your life at the end of the day. Okay, these things have to be told to the doctor. Also, usually there is a physical activity readiness questionnaire which is used. Which this is used worldwide. It comes out every single year, and this is the gold standard in checking whether a person is ready to take up physical activity or not. So this has main questions pertaining to the heart condition of the patient, the cholesterol, any medications the person is on, which might, like for example, the person is on blood thinners, and any injury they might be like bleed out. Okay, so this takes into consideration what medications they are on, what kind of condition they have. Do they have a diabetes? Did they have a spinal surgery? Do they have any heart condition? So these physical activity readiness questionnaires really help in understanding whether you are fit to participate in physical activity or not. And this is mandatory. This has been made mandatory in a lot of countries. Unfortunately, in India, it has still not been made mandatory. But this is what, like we were talking about, that we will be utilizing this because this is absolutely essential. Guys, do not take your health just, like very lightly, because this could literally save your life. I have had people who have had severe conditions and they were still under the thing that we want to exercise, and no, they didn't land up in such a great place. So please understand, it's important to go ahead with telling your conditions, getting through and understanding the physical activity readiness questionnaire, telling your doctor about any symptoms you have been getting, even though you're not getting any pain at all, and then going ahead with your fitness test and fitness training.
Okay, now still sticking on with medical conditions and other conditions. Research also says that that such fitness tests, if we keep doing and performing, it helps us to things like high blood pressure or heart diseases, strokes, etc. It helps us preventing them. Is this true, or again are these just facts randomly put on the internet?
No, no, this is absolutely true. As I told you, for example, we have somebody in fitness, okay? They have already cleared their musculoskeletal assessment. They are doing absolutely fine. And they have been cleared by their doctor to do a fitness test. Now they try to do a bruise test where they have to walk on the treadmill with a certain speed at a certain inclination, and they start to not being able to walk. They suffer with not being able to breathe properly. Okay, their heart rate goes up. First signs of them having cardiac condition. So immediately we have a process in place where we can send them for getting an ECG done, getting a Doppler done, finding out exactly what is wrong with the heart. So that is it, like fitness assessment saves the day in the end. Okay. It really helps you avoid any undue condition. Or for example, if you have a tight muscle, which will cause a problem only when you go into running, but you have not been running so far, so you do not know that it will be causing anything. So you're absolutely fine. You want to go into fitness, but your physiotherapist or your doctor performs the complete musculoskeletal assessment, performs the complete fitness assessment, finds out that that particular muscle is very tight, your joint is not moving through the entire range as it should for a normal person, we immediately find the problem and prevent it rather than you trying to go on a run, probably alone by yourself and injuring yourself. So, fitness testing can really save the day. And we all know that prevention is better than cure. So, testing yourself, like we usually go through medical tests, right? Most of us at the beginning of the year, we go through like checking our cholesterol, checking our heart, checking our blood cells, checking our vitamin D3. Why do we do that? Okay, the only sole reason being that we want to be rest assured that we are healthy. And if something has gone wrong, we will have enough time to take the right precautions to avoid anything in future. The same way, doing a fitness test or doing a musculoskeletal assessment gives you an entire idea about your physical body. Okay, what are you capable of doing? What will you get injured while doing? And what you should absolutely not go ahead with doing, even with precautions. So, what is completely contraindicated? So, I believe that fitness testing, just like the regular biochemical test that we do like 3 to 4 times a year, you should be doing a fitness test also to be able to understand how fit you are and what you need to do ahead.
Well, I don't think anybody could have put in a better manner out there. Dr. Mukherjee, I think you've made it very simple and people would have a new view of the fitness test they have been doing. I don't know, most of the people know the fitness test that they do is a musculoskeletal evaluation. I think there's a lot of knowledge given out today. Now, before we go, this is my last question to you. I know it's been a long session, but this is my very last question to you. Now, two people, two friends joining a gym together. Okay. Very commonly this happens. Both have had a gap of say a year odd. They've not done any major fitness activity. But one of them is still been a little active. He's been running. He's been still a little more active than the other friend. Now, obviously, when the fitness evaluation is done, his fitness level, the person who's been active, is going to be better. Correct? So, and the other friend
Correct.
is lower side. But sadly, they both get the same schedule. Okay, both have the same schedule given, even though the other person has a better fitness evaluation. This is how right now the system works. It becomes a namesake test and things like that. I want you to explain to the people out there quickly how much of a reflection the output of a fitness test has on their workout plan or on their workout schedule.
So basically, we're talking about somebody who has had little bit of fitness in their life, not been completely sedentary, and comparing them to somebody who has been completely sedentary. Now, again, I would like to repeat what I said before. You can't just look at them and tell this person is fit, this person is not fit. How do you know? With a fitness test. Fitness test will tell you the exact numerical values. This is where this person stands in endurance, and this is where the other person stands. And that is how you understand that their baseline level is going to be very different. So somebody who has been very active is going to have almost a normal baseline level, and somebody who has been inactive is going to have like a very extreme baseline level where everything is low. Strength is low, endurance is low, agility is low, everything is low. So definitely the exercises that they will be given will be very different because this person will have different goals. The person who is fit and the unfit person is going to have slightly different goals from him, right? And the time duration taken to achieve those goals is also going to be different. So that is why we cannot put every person into the same cookie cutter kind of exercise. That usually what happens, like 20 people are being given exercise at the same time. Like, how do you know that this person's fitness is different from that person's fitness? And how do you know that that person is capable of doing that exercise? So we usually have that, in the name of, reducing the pricing, reducing the costing, having a lot of people work out together. A lot of people are giving exercises to multiple people, but you don't even know, you don't know what level of fitness they are in. I mean, what if you're giving a class of 20 people and one person collapses in that class? Like just because you did not do a fitness testing or you had no idea that you had to do a fitness testing. So we as an entire community of people giving fitness, training, giving exercises, we should be responsible. We must be responsible for our clients' health. Imagine it's their life that they're giving it to you, and you cannot just take it lightly. Give them an exercise below their fitness level, they might never improve because they are basically doing whatever they already do. And giving them something much higher than them, they might just collapse on the ground. So understanding their level and then going ahead with their fitness is very, very important. This is what I tell everybody. Like, two people are not the same. The same as two patients are not the same. I just had my post about it today that, you can't just tell, okay, this person has same diagnosis, this person has same diagnosis, okay, same treatment. We cannot do that. We have to understand that individual requirements are very different.
Like they say in Hindi, har ungli ek barabar nahi hoti. It's like that. So
Correct.
anyway, Dr. Mukherjee, this has been a good conversation. But before we sign off, as usual, I'm going to ask you, give your punchline for today.
So I was actually reading somebody's blog, and I heard this, that if you do hard things, then life becomes easy. And if you try to do easy things, life becomes hard. So when we are trying to go on YouTube and Google and trying to make it, like easy, like, okay, fine, I can do a fitness test, I can take care of my own health and all, life is going to become very hard because you're probably going to have injuries, and there might be a lot of medical conditions that will not be screened and not come into the picture. So you might directly land up into the hospital. So life is going to be hard. But when you invest in your health, you actually do things the hard way, you meet a doctor, you meet a physiotherapist, get a screening done, life is going to be very easy because you will not be getting injured as much. Even if you get injured, you will know exactly what to do. You will be more fitter and you will be more wiser. You'll be able to take your life ahead more easily. So do the hard thing, guys, and make life easy.
Well, I think those were golden words said, and I would just, I think, end it by saying, guys, there's a lot of information out there. There's a lot of things out there. They're telling you can do this, you can do that. Go to proper people, go to certified people, go to experienced people, and I'm sure help is going to be given to anybody who asks for help. I think similar was the line Dumbledore tells in Hogwarts. Help will be given to
Correct.
everyone who asks for it. So I'll say it's very simple. It's like that. You guys have any doubts on fitness, any doubts on health, any doubts on your nutrition, you can DM me, you can DM Dr. Mukherjee, you can DM Gauri. We guys keep coming live and we guys are very open. We are ready to help people. A lot of people have been DMing me for a lot of tips, and I go back to Dr. Mukherjee, I go back to Gauri and ask them and keep putting the solution back to them. So it's very simple. You guys can get in touch with us for your workout plans. You have any physiotherapy needs, any movement needs, if you are wanting to get free from pain, as I keep putting up nowadays. So we're doing a lot of services. So you can get in touch with us. We're always there to help. So Dr. Mukherjee, I thank you for today's conversation. It's been a lovely conversation. I think you have given a new meaning, a new idea to the fitness test out there. A lot of people, I'm sure, who've seen the video and are going to see the video again would 100% get a lot of knowledge out of it. So, it's been a good session again. As I say, the ocean of knowledge you've given us again today
Thank you. Thank you so much.
on fitness tests. So we've seen a yo-yo, we've seen the musculoskeletal evaluation. So guys, we will be back next week again with another topic, another something interesting, Dr. Mukherjee and I would be live again with Gauri on Saturday, and we would be talking on a topic. I would be putting up the topic very soon. So guys, thank you so much for tuning in. I hope you guys enjoyed the video, and if you enjoy the video, do like it and do share it. Thank you, Dr. Mukherjee. Thank you so much for joining us.
Thank you. Bye
So
bye.
guys, Dr. Mukherjee and Hustling Muscles signing off. Thank you. Have a great evening ahead.